What's up, guys? Paul again, TRT bruh. Today is Thursday, April 2nd. I had my 7th injection this morning, so this is the 6-week update. Kind of hard to believe it's been a month and a half, but it is what it is, I guess. Starting to see some more benefits or effects, I guess would be a better term. Again, as I mentioned from my last video, after the 1-month blood test results came back, doc decided to go ahead and up my dosage to 140 milligrams of testosterone cypionate per week, still maintaining the same 500 IU of HCG, and because my estradiol level came back a little higher than the doctor wanted, he did start me on Arimidex. That's mostly what this video is going to be about. So let me just start by saying, after the injection last week, I felt fantastic, significantly increased in energy. I was finishing up on a deload week, Friday and Saturday, deadlift and overhead press, so I wasn't lifting very heavy weights, but I felt extremely strong. I had a lot of energy in the gym, and then when I started squatting on Monday morning, that was the best squat session I've had in as long as I can remember. Felt super strong. Actually, the first time I've squatted completely without pain in as long as I can remember. That's probably partially due to some changes in technique, getting the Olympic lifting shoes, but I do think that obviously the testosterone replacement will also help with recovery and probably healing some of the muscle tissue very, very close to the tendons in my hips that seem to have been causing me some problems with the hip flexors. Sleep has been good. I'm going to make another video about some issues with sleep and TRT, but I'll probably make that maybe tomorrow, but definitely this weekend at some point I'll make that video, and you'll want to watch out for that one. Okay, so like I said, this video primarily going to be about Arimidex. So my test level, or my blood test level of estradiol came back at a 29. So the doctor advised me that he typically likes to keep his patients between 20 and 25. And the research on that shows that that's a pretty, that's kind of the standard range. And again, estrogen levels in men is not something that's been studied extensively, but we do know that as far as from the research that they've done, that does seem to be the kind of sweet spot for healthy, feeling healthy, feeling strong, energetic. It seems to be the sweet spot in avoiding bone issues, osteoporosis, the same kind of things that low estrogen causes in women. Strength, sex drive, all that stuff seems to be at its best in that 20 to 25 range. Now, the interesting thing is that there's no standardized test range. The same thing with testosterone. The ranges are always different. Most insurance companies view LabCorp as being the standard by which they base their coverages on. So now, when I originally got blood test back in January, that kind of started me on this whole thing. My estrogen level, like I stated before, was very low. It was a 6 on the sensitive assay test, and that was a range between 3 and I'm trying to remember exactly, 3 and like 70. I can't remember exactly what the high end was, but I know the low end was 3. The low end of normal was 3. Now, the sensitive assay test is the most accurate for people when they are in low range. And again, there is no separate test for men and women, so the ranges are there is some question as to exactly how accurate they are and how it applies to male health. But I was very, very low at that time. Now, the interesting thing to me was that when I got these 1 month blood tests after starting TRT, my trough day, the lowest that my testosterone levels would be right before I had another injection, so it had been 7 full days. My testosterone was at 440 or something. I'm trying to remember exactly. I don't have the blood test right in front of me. But the estrogen level was a 29. So the doctor went ahead and prescribed the Arimidex. Now, when I went back and looked at it, I realized that they had actually done the standard assay test. And the standard assay test is perfectly fine for women. But for men, it seems to be not nearly as accurate. And especially when you get to the low end of ranges. The sensitive assay is much more accurate when it comes to low-end estrogen levels. Obviously, as men, we're going to have low-end estrogen levels, even if we're in a healthy range compared to where women estrogen levels will be, men will be lower. So, unfortunately, this was after I'd already taken the pill. Now, the doctor prescribed me 1 milligram Arimidex. There are higher doses. And his protocol was going to be to give me that along with my injection every week. So, like I said, I felt great Friday that day. Saturday I felt great. Sunday I felt okay. I was kind of dealing with a little sinus stuff and hadn't had a good night's sleep, so I kind of wrote that off. Monday I woke up, had a great squat session, but that afternoon after I got home from work, I was dead. I was completely tanked out of energy at like 4 in the afternoon. The same thing the next day, Tuesday, was completely dead. Now by Wednesday, I was feeling relatively normal, but still fairly fatigued. So after talking with some people, getting some responses on Reddit, it does appear that 1 milligram Arimidex directly after your injection is entirely too much. They pointed me to some research. I looked up my own, looked up some other research online as well. I found that 1 milligram Arimidex per week is something that a lot of guys use as standard dosage when they're taking upwards of 500 to 1,000 milligrams of testosterone. That's how strong Arimidex is. It's a very, very strong medication. So, essentially what happened, even though my test levels were somewhat elevated and my estrogen level was somewhat elevated, it wasn't nearly to the point where it required a medicine as strong as Arimidex, at least at that dosage of 1 milligram per week. Now, the half-life of Arimidex and testosterone is different as well. So the testosterone is going to peak at a different time than the Arimidex is going to peak. Ideally, the goal is you want the Arimidex to peak when your testosterone does. And so what I found, what I was recommended by some people, like I said, on Reddit, a great community, by the way, and I really appreciate all the support and comments from everyone there. But what they were recommending is 0.25 milligrams 24 hours after the injection. That should put the peak of the medication at the same time the testosterone is peaking, so that way it will keep the estrogen from getting too high between shots. So once again, I haven't had really any estrogenic side effects. No puffy or soreness in the nipples, nothing like that. Sex drive has been good. Everything's been fine with the testosterone. I hadn't seen a whole lot of the benefits until upping the dose, but no side effects at least. So just a word of advice that I should have known beforehand, and I really should have done more research before just swallowing that pill. Is entirely too much medication, and it's not entirely the doctor's fault. That is the dosage that they sell the medication in, 1 milligram, 2 milligrams. And a doctor is very rarely going to suggest that you split the pill. Now, especially in my case, going to a testosterone clinic, they're trying to get everything done while you're there. So, I mean, they give you a cup and water with this pill, expecting you to take it right then. Now, to not get anybody in trouble, including myself, I'm not doing that anymore. I'm taking the pill with me. I'm not taking it at the store. So I'm going to be splitting those pills. I'm going to try the a quarter of the pill, 0.25 milligrams, or as close as I can possibly get it, 24 hours after my injections. And then again, when we have the blood test drawn again in another 3 weeks, hopefully we'll see a better response from that. I know the testosterone levels are going to be elevated. I still don't know if it's going to be the correct dosage, obviously. I'll kind of have to play it by ear and see, but I'm still kind of waiting to see that real clarity, mental clarity that a lot of people talk about, focus increase, and a lot of people claim that the strength increase is pretty quick to come about with testosterone therapy. Again, it might be a little different for me since I'd already been doing fairly heavy strength training before this. So anyways, that's the video for now. Again, be very, very careful with Arimidex because it will jack you up. I seriously, I felt worse those 2.5 days when it kicked in and the testosterone was starting to taper down. I felt worse those 2 days than I did before I even started TRT. So do your research. Make sure you know that the doctor knows what he's saying and what he's doing and what he's recommending. And again, try as much as you can to take your own medical your own medical treatments into your own hands as far as the knowledge part goes. That'll probably help me, I know for sure, avoid issues like this coming up in the future. But again, I'll be posting another video in the next couple of days about some sleep issue things, and hopefully it'll be somewhat helpful for other people too. It's the information I'm going to share has certainly been helpful for me. Anyways, that's it. Have a great day. If I don't see you again before Easter, have a great Easter. Enjoy your time with your family and have a good one. Bye.